Hello, I'm Gladys,
Hi, I'm Azana.
and we are third year medical students.
Yeah.
All right, so we're here to give you a video on the pros and cons of our favorite rotation surgery.
In the whole world.
So we're currently third year medical students. As a third year medical student, you do clinical rotations. This is our first year actually being in the field, being on the grounds, although, with COVID and everything, yeah, this is our first time. But for me, my first rotation was IM, then it was FM, and then we just finished surgery. And let me tell you, surgery was, it was a journey. It was a journey, yeah.
Wow, great words, great wise words.
Yeah, thank you very much. So we're kind of gonna, from that, I guess you can tell how our experience in surgery was. But this video is not to discourage you, but to encourage you to choose a specialty that you love. We hope that the tips that we're going to give you, the pros and cons, will help you to decide whether or not surgery is for you and whether or not it's something that you think you would actually like. So yeah, so we can go right into it. So pro number one for surgery was instant gratification.
Oh,
yeah.
Was that number one? I thought.
Okay, what is it? Actually, you're right.
So for surgery, pro number one is
the money.
The money.
The ego, the dollars, the pesos,
the guap,
the kudi.
The
Okay,
dough.
it was money.
It's money.
It's money actually. I mean, not money. We weren't getting paid for being students there. We weren't paid even a cent.
Not even
we
a
were the
zilch,
ones spending.
Not even a Metro card.
Exactly. We were spending to be there. We were spending money to be there through our tuition and everything. So we were paying to work, essentially. So, however, for an attending, for someone who's a surgeon, who's actually working as a surgeon, the general surgeon gets paid about $300K a year. And that's only if you're a general surgeon. So if you decide to specialize as a surgeon, you can make so much more. You have so much more capacity. You can make $1 million. You're capable of doing that as a surgeon.
And moving on to the other pros that Gladys mentioned was the instant gratification. So in other specialties such as family medicine, you usually kind of have to follow a patient over a period of time. Oh, did you take your medicine? Yeah. Oh, you have to take your medicine. And they don't take their medicine. But in terms of surgery,
it's a cycle.
Yeah, the patient comes in, you take them to the OR, snip, snap, and then you're done with the patient. Like, you can literally fix the patient in front of you, whatever is going on. You can kind of attack that at the same time and be done with it. And you can feel accomplished that, okay, I just saved this patient's life or their organ.
And I guess the third pro would be short. Short rounds. If anyone who has taken actually short rounds and then short-term care. So that's why I would say short. So that includes actually two pros.
Wow.
You see what I did there?
Look at you.
Anyways, but short rounds, if you've done internal medicine, if you know what internal medicine is, if you've shadowed an internist, you know that at least if you're an inpatient, rounds can take up, for one patient, can take up to 30 minutes to an hour just to figure out why a patient's potassium is so high. So you can spend a long time doing rounds in something like internal medicine. But then in surgery, all they really care about is whether or not there's an infection at the surgical site. Obviously, that's not all they care about, but you get the point. Even in the clinic, appointments were pretty short as well. Like, it was short. Everything was just quick and straight to the point. Going back to instant gratification, everything is quick. So even in the clinic, most of the patients that come in, they're just coming in because of post-op care. The surgeon wants to make sure that whatever site they actually did the surgery on is actually doing well, and to make sure that the patient is also doing well and they're satisfied with the care. So,
but the only thing I would put to that is that if you're in the surgical ICU, the rounds can be a little bit longer approaching medicine, but because those are really sick patients, you know, they're in the ICU, so you kind of want to pay more attention to them. Even something as potassium can be a huge issue because, you know, unfortunately, while on the CQ in, you know, one of the places I was covering, a patient ended up passing away because their potassium was too high. And that caused them to have an arrhythmia. It's a whole thing, you can read up on it. So, you know, even though it does seem trivial, something as simple as like potassium being high needs to be monitored, like, you know, very minutely, because it could mean life or death. And in the case of that patient, unfortunately, it was death. So another pro is the prestige. There's and respect. So there's a certain amount of respect that all doctors get because you're in the medical professional, so you're basically saving lives. But even within that, surgeons get even of a higher type of prestige because they're supposed to be the smartest. They're doing these intense surgeries. You know, they're literally holding life or death in their hands most of the time. So there's that type of respect that comes along with it, and kind of a feeling of superiority, you know, like I'm the top dog around here, I'm the surgeon. So there's that.
I agree. But that could also be a con, but we'll go into that. Another pro is it's pretty hands-on surgery. In other field like internal medicine, as I mentioned before.
Girl always talks about internal medicine. I wonder why.
Yeah, you wonder why. If you can guess why I mention a lot in the comment section, maybe you'll get a giveaway or a surprise. Anyways, so it's something like internal medicine is a very cerebral. Every field is cerebral. But internal medicine, you really have to use your brain to figure out what's going on. As I said before, if the potassium goes up by even 0.5 points, they need to crack your brains
This girl's
to
been
figure
traumatized.
out. I'm telling you, no, because there's been times when we would just stay there for a good hour just to figure out why the potassium is high. Anyways, but it's important actually. So in that case, you know, you need to figure out things and then you act accordingly. You give them more IV fluids, or you do this and that, adjust some things. But then in surgery, you legit, if someone has appendicitis, all right, what's the first thing you do, Azana?
You take them to the OR.
You take them straight to the OR. You don't even think twice about it. Appendicitis? Exactly. You look at the criteria 1, 2, 3, 4. All right, you're going to the OR. You fix the problem. After that, the patient is happy. They're no longer in pain.
Exactly.
They're no longer in pain. Let me compare it to another specialty or field. Family medicine. Family medicine, most patients, they come in, they have chronic issues like hypertension, diabetes. Give me another one.
You said diabetes.
Okay, let's stick to
Heart
those
disease.
two. Heart disease. And hypertension, it takes a long time for the doctor to manage it, right? Because even a patient, they might decide not to be compliant with the medication. So they keep coming in with the same issue. I have chest pain. Oh, well, you should probably try to manage your blood pressure. All right, thank you, doc. Go back. Still not taking medication. And then you as a doctor, you're confused as to what to do. Because all you can really say is keep taking your blood pressure medication until at some point it gets to the point of no return. And then at that point, who really fixes the issues? It's the surgeon.
Oh yeah,
it's the
definitely.
surgeon. It's the surgeon that ends up fixing the end stage results.
But it's funny because we had an attendant. He was like, "Oh, I'm just a dumb surgeon. All I do, I go in and I chop this and all that." Yeah. Whenever he wanted to be like sarcastic, he'd be like, "Oh yeah, don't listen to the dumb surgeon. All they do is chop things up." But you know, all they do is chop things up.
Yeah, but
just kidding.
Just kidding. You never know. We might just decide to go into surgery. Yeah, surgery rocks. All right. So now the cons. What could possibly?
I mean, are there any cons?
What could possibly go wrong with surgery? Like surgery, it's what everyone envisions that they could be. Even in Grey's Anatomy, who do you admire?
Facts,
the surgeon.
True.
General surgeon.
Actually, most of the shows are about surgeons.
They glorify the surgeon. So what exactly could be wrong with them? What could be wrong with the field? Well, we're going to tell you.